Good news and the bad news. The bad news is that coronavirus we cannot stop from spreading. The good news, we cannot stop from spreading. I know that's a little cheesy, but there are 5 good reasons why we need to open the country now, and in this video I'll show you what they are. Reason number 1 is by this time we have enough evidence that show that most people do not develop serious problems. A couple of recent studies from California and one from New York shows that infection rate is actually up to 80 times higher than what number tested. So what that means that possibly up to 15% of New Yorkers already have been infected, just they have no symptoms, which means for the city of New York, they calculated as a 20.1%, meaning 1.6 million New Yorkers have tested are positive and they don't even know about it. Data from New York City shows that less than 0.01% population under age of 45 die from coronavirus. Age 45 to 65, that rate is 0.1%, 0.1%. And then over age of 65, the death rate is 1.7%. Statistically, people under age of 18, their death rate is 0 per 100,000 population. It's not to say there is not like 1 or 2 cases across the country that no one died from, no 11-year-old or 2-year-old died from. Statistically, 0 per 100,000 population. Over 2/3 of New Yorkers have died that died from coronavirus. Over 2/3 were over age of 70. Over 90% of people that died had underlying conditions, and we know what those are: heart disease, lung disease, cancer, diabetes, and obesity. So point number 2, what did we learn from this? We learned who the most vulnerable population is: people over age 70 and people with underlying health conditions. Our job, 1, will be protecting those most vulnerable, not trying to protect everybody, because they already told us we can't stop these things. So therefore, we can't protect everybody from getting this. So why are we trying so hard to protect 18 and 25 and 35-year-olds? It just doesn't work. Point number 3, the longer we prolong this, the longer we extend immunity, build up immunity, or as they call it, a herd immunity, which I'll explain. We know scientifically that throughout the history, the last decades that we've been monitoring people with different diseases, that the people build up natural immunity. Most people have a natural mechanism that their bodies fight diseases. They fight the viruses, they fight bacteria. We need to focus and use those people with immune system to help all of us. We have also learned that in this process, over 50% of people don't even know they had a virus or they're positive. They are what they call asymptomatic. No symptoms of any kind. Point number 4, by isolating everybody in their homes, we are preventing people from other treatments, which causes them to die prematurely because the access to the hospital is limited. Data shows that hospital admissions, emergency room admissions, is down 50% or more. So that means that a lot of people are skeptical either to go to the hospital, they're afraid they're going to contact the virus, or they were told don't overwhelm the hospital. So a lot of clinics that we use for screening, cancer and other tests, are closed. So people are not getting diagnosed early enough to treat certain diseases or conditions that are normally treatable. Cancer patients were being deferred their chemotherapy because of lack of admissions. Cancer screenings, biopsies, dermatology, skin cancer, people are postponing those which are easily treatable, but it may turn into something much worse or cause a premature death. 80% of brain surgery cases were deferred, causing additional aneurysm, brain damage, or premature death as well. Finally, Point number 5. We clearly have identified the population who have immunity and that can be used to protect us all. So why aren't we using them? Why aren't we using the young and the healthy to build a herd immunity and therefore at the same time protecting the elderly? Has this been done before? Well, yes, it has. Back in the World War I and World War II, we sacrificed millions of young men of fighting age. Apparently the country did not want to speak German or Japanese at the time. So we sacrificed hundreds of thousands of lives of young men, mostly who volunteered for this, to build a herd immunity, if you would, to protect the elder, the children, the women. So it's been done before. So knowing all this, I think it's time for us to open the businesses, open the country, stop the further damage to the economy, to livelihood, and social well-being of a population. Protect the elderly, people with underlying conditions, test people that work with elderly, screen them every day, screen them for antibodies to see who may be safer to return to work, who's not. But the rest of the population, let the people go. Let the people assume their daily lives, open the businesses, and one of the items that the government can do is remove the liability. So if you contact the virus, if you should get ill from it or if you should die, you cannot sue Walmart or the restaurant or pizza place or the gas stations because you contacted the virus there. We have to take that away off the table. But we need to resume our daily lives. So America, it's time to open up and get back to business. We know what to do. We know who the vulnerable are. We know who to protect or we have to protect, but we need to know that we can let the other ones go.